Been duking it out on Capitol Hill the last several days in the Finance Committee there. One of the sticking points is the issue of mandatory health insurance. Some call it another tax on Americans. Is it or is it not? And what about the final bill, what it's going to look like? Congressman Chris Van Hollen joins us today. He's the chairman of the Democratic Congressional Campaign Committee. Also, Republican Congressman Dave Camp is with us, ranking member of the Ways and Means Committee. Gentlemen, good to see you both. Thank you for joining us today.
Good to be with you.
Representative Van Hollen, let me start with you. You're following, I'm sure, what's going on the Senate side. The House already has its bill, but the Senate now wrangling in finance about the issue of mandatory health, about the public option, whether there will be one or not. Are you watching aghast, or are you encouraged? How are you taking it all in right now?
Well, we're following very closely what's going on the Senate side. As you know, in the House, all three committees that have jurisdiction over health care have now reported bills. We're waiting for the Senate Finance Committee to complete its work so we can see exactly what they come up with. But we're all moving together in the same general direction, which is to try and provide health care reform, comprehensive health care reform for all Americans, and get a bill to the desk.
Very quickly, it doesn't look like there will be a public option out of the Finance Committee bill. Is that a deal breaker? Speaker Pelosi thinks it is. Do you?
Look, I really can't speak to the Senate Finance Committee. What I can say is the House bill will have a public option. There's a large amount of support on the House side to move forward with the public option as a way to, again, provide competition to the private insurance companies and more choice to consumers.
Representative Camp, where do you come down on this issue of mandatory insurance and whether or not it's a tax on the average American? There was a bit of a tussle between George Stephanopoulos and the president this weekend over the definition of a tax and whether or not it is. What do you think?
Well, Stephanopoulos was right. I mean, clearly it is a tax. If you're going to have to pay more to fund a government program, that's a tax. And I think everybody understands that. And I think we've seen that in this debate where they'll say things like, well, your Medicare benefits aren't going to change, but we're going to cut Medicare $500 billion. Look, I think what we've got a real problem with is this whole idea that the administration is trying to intimidate health plans from letting people know what's actually in these bills. CMS issued a gag order on all health plans from communicating with seniors, and that reverses a long-time Clinton administration policy that said, look, it's a constitutional right to know what's in these bills.
You're talking about a letter that Humana sent to its participants warning that millions of seniors and disabled individuals could lose many of the important benefits and services that make Medicare Advantage health plans so valuable. Isn't it a little early, sir, to be sending a letter out? We don't even know what's going to be in the final bill.
Well, CBO has said the exact same thing. That's the Congressional Budget Office, which scores the legislation that we're on. But I think the important thing is, why not be able to communicate what might be in these bills? Look, we've had a hard time getting information. It's entirely possible that they won't lose any of this coverage too, isn't it? Let me finish. I mean, we've had a hard time getting information. We've gone from rushing this thing through now to preventing people from actually having a real discussion about it. I think that's wrong. Right. It reverses a long-time Clinton policy. I think that's a mistake.
Representative Van Hollen, what frustrated a lot of folks about that was the AARP was allowed to send out all kinds of information. They actually support what's happening in Congress. Is that a double standard?
Look, I'm glad Dave raised this issue. It's always bad for anyone to send out misleading information. In this case,
So Humana was misleading, but the AARP was not?
This was absolutely misleading information. The federal agency that oversees CMS, a nonpartisan agency, called them out on it. And not only did they provide misleading information, but they're using taxpayer dollars. Let's be very clear here. These are the Medicare Advantage plans. They're getting 14% extra taxpayer subsidy over the regular fee-for-service Medicare plans. Their profits are going through the roof. It's just false to say that the only way they can deal with it.
So to you, cutting Medicare Advantage is not the same as cutting Medicare, even though it increases benefits for many, many seniors.
Absolutely. Their soaring profits demonstrate very clearly that if they just play by the same rules as everybody else, they can provide benefits and not have to keep the same profits.
They get a
Look, I have to jump in here.
No, profits aren't bad, but these are profits based on taxpayer subsidy, 14% subsidy above what every other private provider gets.
I have to jump
That's
in
just
here.
Unfair.
What they put out is not misleading. Look, CBO says Medicare beneficiaries' benefits are going to go down. Medicare Advantage is Medicare. Look, they earn 4%. That is less than other providers in Medicare. So to say they're getting these, high profits is just wrong, misleading, and untrue. And so I think we really want to get to the facts. Why not let them communicate as AARP does? Why reverse this Clinton-era policy? I do think there is a right to know. There's a constitutional right to communicate. They've really tried to hide what's in these bills.
But isn't it interesting,
along.
Representative Kemp, it strikes me that we have spent now, in the last 4-minute interview here, we've spent roughly half the time on what is essentially a sidebar our issue, rather than discussing the merits of whatever is being discussed in Congress. And that seems to be the nature of this health care debate. We get off topic on so many tangential issues rather than discussing the heart of the matter to begin with.
Look, cutting Medicare is not a sidebar issue. You tell that to seniors. That is a major issue. And so I think to characterize whether Medicare is being cut as a sidebar issue is just,
our colleagues
not
continuing
true.
to confuse the notion of cutting profits, taxpayer-subsidized profits, means taxing benefits. I understand why these guys want to protect the insurance companies. They're the people who right now are going to face a whole lot more competition under these various plans.
CBO says that their benefits are going to go down. That's a Congressional Budget Office. That's not
payments. They said the payments, including profits, will go down.
I wish I had more time, but we can't spend as much time as they did with Muammar Gaddafi at the UN yesterday.
Thank you.
Thank you both for joining us today. Appreciate it very much.
Thanks.
Representative Kemp.